Hello. Today on All Things Adaptive, we're joined by two incredible advocates leading the movement to make prosthetics and orthoses care accessible for everybody. First, Kyle Stepp. He's a cancer survivor, para triathlete, and one of the national leads for So Everybody Can Move. Kyle's journey from battling cancer as a teenager, becoming a U.S. national champion in para triathlon. He's inspired countless others to see movement as medicine and access to equipment as a right for everybody. Joining him is also Cheryl Sachs. Cheryl is a certified prosthetist and orthotist and a lead advocate for So Everybody Can Move in Maryland. Cheryl was recently named the 2024 ONP Woman of the Year for her leadership in passing legislation that ensures coverage for activity-specific prosthetics and orthosis is law and covered by insurance companies. Together, they're changing systems, reshaping policy, and reminding all of us that the ability to move shouldn't depend on privilege or permission. So today, I interview them both and hear about their organization So Everybody Can Move, so that you can learn how you can get involved and join their mission to pass legislation in every single state so that insurance companies will cover prosthetics, orthoses, mobility devices, and in the future, even wheelchairs for people so that they can live healthy and active lives and play sports, do whatever they want to do. Here we go. Gotcha. Great. Okay. Very cool. Well, just to get into it, Kyle and Cheryl, would you please tell me about So Everybody Can Move? What is the mission?
Yeah,
And what does it do? What are the effects from your work that you do?
absolutely. Well, Alex, so Everybody Can Move. We are a national disability rights and healthcare initiative that's really working to make prosthetic and orthotic care a guaranteed part of healthcare. And what that looks like is ensuring that individuals with limb loss and limb difference can get access to the comprehensive range of the devices that we need to restore back to physical activity, our independence, our well-being. And so the work we're doing is really rooted in fixing outdated insurance policies through state by state legislative reform. And so, unfortunately, insurance right now often views the devices outside of the basic ambulation as not medically necessary. So, the devices for physical activity, the devices for showering and bathing, um, are that really restore our function as a part of our community as not medically necessary. So, what we've done is through grassroots advocacy, going state by state by state, reforming state laws to increase access to coverage through our legislation.
Wow. So the you are in layman's term, how do we understand that? You're people who want to have a secondary device or
Yeah,
a prosthetic or orthosis that helps them live life more fully or to play a sport or to do an activity. Now, this legislation that you're getting passed in states will require the insurance companies to cover that piece of equipment. Is that accurate?
exactly. So what I will do is I want to kind of explain. So the challenge is essentially when you acquire a disability or you're born with a disability, you're often thrown into this reality of how broken our healthcare system is. Because when I was diagnosed with osteosarcoma when I was 14 years old, I had a limb salvage, and the limb salvage required me to be an orthosis user. And so I would only be given one orthotic for simple walking. And are you going to tell a 14-year-old kid that you can only walk? That's a really bad idea, because what they're going to do is break all of their devices over and over because they're not designed to do high intensity activity, whether that is running, that is biking, that's hiking. And so those devices that are designed to do those things, insurance says those aren't medically necessary for you. So we're not going to cover those. And so what our legislation does is it redefines what medical necessity is and really redefines the access to coverage for those range of devices to restore the function. So exactly. So if you acquire a disability and you have to have an amputation, not only are you going to get access to your daily device that you need for returning back to walking, but you'll also get access to your walking device and in some states, showering and bathing. And so, Cheryl, do you have anything you want to add to that?
Yeah, I mean, this is really important work because what we're dealing with right now is individuals are kind of doing one of three things. One is they're not being physically active because they don't feel like they can with their current device. The second is exactly what you heard Kyle describe, which is they're being physically active with a device that's not meant for it, and they're breaking it, or they're hurting themselves, or both in the process. Or third is they're finding charities to help pay for these physical activity special devices, and they're not special. They're just secondary. And that's kind of the reality of a lot of individuals right now. So this legislation is really opening the doors for children and adults across the country to live their lives fully.
Exactly. And I think it comes down to something really simple, Alec, is movement is healthcare. And being able to walk your kid to school, hike with your friends, shower safely should not depend on your insurance company's definition of medical necessity. When people are denied these devices, the results are predictable. It's less movement, it's isolation, it's depression, it's preventable chronic disease. And the system pays more in the long term when they refuse to cover it. And we are ensuring that people can get access to those devices. And we believe it's cost effective healthcare.
Right. Can we just take a step back for a second
Yeah.
so that anybody listening can understand if they're not already aware? Can you define and draw us a picture of a prosthetic and orthosis so that people understand what those devices are? Because I guess if I'm listening and I'm not quite understanding, you think you get a prosthetic leg. I think most people understand what a prosthetic leg is, but if you get a prosthetic leg, it's like why can't you go and play sports? Like why wouldn't one be enough to be sufficient for all of life and activities and playing sports and things? So
Yeah,
what are those things and why isn't that sufficient?
yeah, it's a really great question. So we'll start with prostheses. And in the context of this legislation, we're talking about prosthetic legs and prosthetic arms. And that's for all different levels of limb loss and limb difference. So whether you're missing part of your hand, whether you're missing your arm above the elbow, you're missing your leg below the knee, above the knee. Those are the types of prosthetic devices that we're referring to. So a prosthesis is missing, replacing part of your body that is missing. And these prostheses are usually modular. They're made up of different components. And the components are really not designed where one component can do everything. So when you have a prosthesis for walking, for example, you might have a prosthetics foot that's designed for allowing for you to walk over uneven terrain. You may have a prosthetic knee that allows for you to walk faster and slower. It keeps up with your other leg. But those components may be really inappropriate for hiking, or they may be really inappropriate for running. There's some prosthetic knees where you can't actually run in it. Um, so that's why in those cases, a different type of prosthesis would be more medically necessary. Same thing for upper extremity, for arm prostheses. The hands or hooks that you may see, oftentimes those are modular, but you can't do a handstand on a multi-articulating prosthetic hand. You would break that hand. So if you have a child who wants to do gymnastics, for example, however, they need a multi-articulating hand for typing and for grasping a pencil in school. That's something that you would need more than one device for. When we're talking about orthoses, those are usually what most folks know as braces. These are external devices that support part of the body. And in this case, we're the legislation varies from state to state. A lot of states are focusing on just custom orthoses. Uh, However, again, that's a decision that each state is making. And we're talking about ankle foot orthoses, which are devices that are used to help someone walk who might have foot drop, or a child who may have cerebral palsy or spina bifida. May even be an upper extremity orthosis for someone who's had a stroke.
Yeah, that makes sense. Appreciate you explaining that. So, um, and I'm guessing I think I understand this, but if I was listening, I'd be like, okay, why don't insurance companies already cover these things?
That's a great question. So I think we always give the example of you have two 16-year-old, high school track stars, and one 16-year-old has an ACL tear. Our current healthcare system will do everything it possibly can to restore their function. They'll cover it. They'll cover the pre-surgery, the surgery itself, the bracing, the rehab to restore them back to full function. But when someone has, either acquires a disability, especially if you have a teammate that's 16 years old that is in a car accident that requires the above knee amputation, they'll say that device in order to be back on the track is not medically necessary. And what we've come to understand is a lot of our current insurance medical necessity standards are outdated, and many of them, truly, we've had conversations with health plans where they recognize that there is a need to modernize their coverage, because I think what we've seen in the past 20 years is prosthetics and orthotics have vastly changed for the better. We're seeing technology providing better outcomes, and people's better ability to restore their function. But at the same time, too, we look at devices like running blades or physical activity devices are relatively new in the grand scheme of the prosthetic orthotic coverage and access. But what we're seeing also is our health plans are not catching up to the current modern device coverage. And so I love for Cheryl to dive into this as well, because ultimately our insurance plans are not meeting the current standard of care.
Yeah, they're really not. And I think that part of what we're seeing is that there's just a general lack of understanding about orthotic and prosthetic care and what that means, what these devices are, how they're made, and the people who actually use them. Because the orthotic and prosthetic population is not overwhelming in the grand scheme of things. And so, unless you know someone with limb loss or limb difference or know someone who wears an orthosis, you probably don't know a whole lot about it. And that goes for the insurance companies who are making decisions about these people's lives. So, one of the things that this movement has really been wonderful at doing is educating individuals, educating the lobbyists for the insurance companies, educating the legislators who are asking for their support as we introduce these bills state by state. And I think that once these individuals learn more about what these devices are and they learn more about the struggles that these individuals are facing due to their lack of care, I think it really kind of opens their eyes as to understanding that the current coverage really is inadequate and trying to figure out a way to really make sure that these individuals' medical necessity is being obtained.
Right. What are some of the costs if somebody doesn't get this covered through their insurance? What are the out of pocket costs for something like? And then I know there's lots of different components and it can get very expensive, but what's the range for a prosthetic leg or prosthetic arm or an AFO, an ankle foot orthosis, or a knee ankle foot orthosis, something like that?
So as you mentioned, it really varies based on the componentry, but I think the big takeaway and what we try to really enforce to the insurance companies is that these activity specific devices are the same exact cost or usually less expensive than the everyday devices they're already paying for. So again, I think it's unfair to give a range just because it is very broad depending on the componentry being used. But I know that when Marilyn, when we were educating the insurance companies and Medicaid about the cost, really showing them side by side two different prostheses, one for everyday walking, one for running, and actually showing them that the running prosthesis was a few $1,000s less, I think was really eye opening for them.
Right. But I think in general, these things cost thousands of dollars. It's not just a
Yeah,
couple $100,
No.
no. Well, so
and
for some of the orthoses, yes. For some of
sure.
the orthoses, it is a few $100s, but yes, the prostheses, you are in the thousands of dollars range. Absolutely. And that's why an out of pocket cost for a patient, it's really not manageable for most individuals.
Right. And I'm sure, Kyle, like you're a high level athlete competing in triathlons. When you get to that level, there's got to be even more expenses when it comes to getting more sport specific than just everyday life. What do you have you had your equipment covered by insurance, or did you have to go out of pocket or to a charity to find
Yeah.
funding for those?
Yeah. So, when I had my above knee amputation in 2020, I'll just tell you, Alec, I was really naive to the fact of how hard it would be to get access to the coverage I needed. And because in my mind, as Cheryl's alluding to, I think there's a misconception and misunderstanding around what is covered and not covered. And, when I became an above knee amputee, my mind was, I'm going to be able to return back to everything. Because, I see Paralympians in the media. I see, the media portraying people with limb loss and limb difference as these superhero type individuals because of like access to these prosthetics. And so my mind was, oh, that should be covered. Like, yeah, this is going to be great. And so my thought was, I'm going to be able to return back to physical activity. I'm going to be able to return back to my daily life. And I remember sitting with my prosthetist and him saying, the device that you need in order to run again is, as we keep saying, is going to be deemed not medically necessary. So you're going to have to rely on charitable support. And so what I did is I just started Googling, grants that are available. And the process for grants are extensive, as I respect as it should be. I think the process to apply for anything to receive charitable support, there's a process to ensure that the funds are going to be used in the proper way. But I think what's really hard is that you shouldn't put your entire life story and beg for help to receive something that should be a basic human right. And I think our charitable organizations are doing amazing work. But ultimately, these devices that are designed to restore your function that should be a basic right should be covered by healthcare. And so I went through the charitable process. I was very luckily supported by Move for Gen. Move for Gen is an amazing organization based in North Carolina that provided me access to my first prosthesis for running and also my first custom socket for cycling. And I remember going through that process, and it took months. It was, you fill out the application, you're waiting for the acceptance, and it's time consuming. And I can now say 2 years later, after New Mexico's legislation has gone into effect, I got to go through the same process as I would for my daily device and have it covered by insurance. I went to my physician, I got a prescription. The prescription was sent to my clinician. My clinician and I worked together to determine which device would be the best one for racing. And we submitted the paperwork to my insurance company, and it was approved. And it was simple as a matter of 3 weeks. And I didn't have to skip a beat. I didn't have to. There's still I think there's an emotional toll when someone has to rely on charitable support and also have to pay out of pocket in the fear of deciding, do I pay for my leg to run, or do I pay for something else that's really important in my life? And so I think what we're starting to see in our states that have enacted legislation, people's lives are changing. They're getting back to the things they love. You're hearing stories of individuals not having to miss school, not having to miss work. They're actually pursuing new careers because of the device allows them to. I'll share a quick story. There was an amazing young man that came to our mobility clinic a few weeks ago in New Mexico. That is, his goal is to be a firefighter, and he's currently an EMT, and he wants to go to the academy to be a firefighter. But one of the requirements in order to be a firefighter is meeting um, PT tests and hitting certain standards. But in order to do that, you need a running leg. And not only that, but also, how time consuming it is to get a leg into his boot. The specific boot he has for being a firefighter. And so now insurance is not only going to cover the foot he needs to put into his boot when he's on call, but also to be able to cover the running blade for him to have training. And so he's able to pursue this career that he's been dreaming of because of this new access and coverage.
Wow, that's amazing. So, can you guys for So Everybody Can Move, you have a mission of 28 by 28. Can you explain what that is? And then how can people get involved if they want to get involved?
Absolutely. And so 20 by 28 is our legislative strategy. And so our goal is to enact So Everybody Can Move legislation in 28 states by the Los Angeles 2028 Paralympics, which is the next time the Paralympics come to the U.S. soil. And so what we've seen through the London 2020, the 2012 Paralympics, and as well as the Paris 2024 Paralympics, is both of those countries actually capitalized on the Paralympics coming to their nation to have disability rights reform. And so we are a part of being the catalyst for that. Our vision is not only to create state-based legislation, but also to have national reform as well. Because our long-term goal is not only creating access and coverage for physical activity for the limb loss, limb difference community, but also ensuring that there's healthcare coverage for the entire disability community, from our wheelchair user community that needs access to activity and sport chairs, to our visually impaired community to have coverage and access for their guides, But our goal is to use this 28 by 28 as a catalyst to have national reform across the country.
And we're
And
on
it's
our way, which is very exciting. So we've had 12 states pass legislation, uh, I'd say in a very short period of time, less than 3 years, which is pretty remarkable for a grassroots advocacy initiative. And we have some states that have already introduced legislation going into the upcoming year. I think most recently, Ohio just introduced their legislation with bipartisan support, which is, again, something that we're seeing with all of our legislation passing with bipartisan support. And so, for individuals who want to get involved, we highly recommend that you go to our website, www.soeverybodycanmove.org, and you can see if there is already an active coalition in your state. You can reach out and we can get you connected with them. And if they're not, we have amazing resources in place that have been designed by Kyle and a lot of the other folks at the national level to really help individuals who want to make change but don't necessarily know how to. One of the things that's been so powerful about this movement is that it's really led and has been successful because of the patient voice. It's giving patients and their families the platform to really share why this legislation is important. I know when I got involved with Maryland's effort 2 years ago, I was a bit of a rookie and I had amazing support from individuals, and we support each other. And I think that's one of the many things that makes this movement so powerful.
and just for reference, how many states have legislation passed that are up to your standards, and how many more are there to go? Do you know those numbers off the top of your head?
Yeah, so we currently have 12 states that have enacted legislation. There's a handful of the states that we are going back to expand their coverage. So insurance in Americas is a quilt that's patchworked. And so we understand is that we believe in incremental progress. And so in each state, our goal is to get to that 100% coverage in each state that state-based legislation can impact. So
Mm.
state-based legislation can impact state-regulated commercial, state employees, and Medicaid. And so our goal in all 28 states is to get to that 100% in all 28 of those states. But then also when we do pursue our federal bill, it's going to capture the rest of our community members that are under federally regulated. And so our strategy is constantly our goal is to keep on expanding the coverage in all of our states. So we've introduced over 40 bills in over 20 states in 3 years. And so we believe is that we have this full court press is that we're taking this very aggressive approach because this reform can't wait. But I want to say to anyone listening to this is what I love about this movement is our advocates are not career lobbyists. They're people who live the issue. We're fellow amputees, we're clinicians, we're parents, we're physical therapists, we're prosthetists, and we're allies that have watched our community and loved ones get denied the care. And what I love about So Everybody Can Move is that there's every single person can find how they can make a difference in this movement. Whether they want to meet with lawmakers, they want to testify in hearings, they want to shape the policy itself that reflects real life impact, because each state coalition runs on community. And that is what the core of this movement is. It's the lived experience matched with the healthcare teams working collaboratively to make a difference. And it's really powerful because you see across the entire United States, we have over 250 leaders. 99% of us don't have a policy background, don't have a law background, don't have an advocacy background. And we learn through the process. And our goal is So Everybody Can Move is we train and we connect and we empower all these leaders to make the change in their community.
That's amazing. That's I think that's how, and I would say, how many of those people have a disability or are in the disability community in some way? Is it a large portion, I'm guessing?
Majority. So
Majority.
it's in every state coalition, it is a part of our culture that people with lived experience are a part of the leadership team. And that is very key. It's, you know, we have to ultimately, if we are going to be creating policy, those that are directly impacted have to have a seat at the table. Not only have a seat at the table, but be a part of driving it. And I think that's what's really beautiful is our clinicians are working hand in hand with the patients that they serve. And, that's really special. It's special for me to be able to serve right alongside the person that is so passionate about providing me the care that I needed. And we were walking the halls together in our state capital, going door to door to door, and educating our elected officials on the problem, but also sharing with them that the solution that they get to help pass.
And that's exactly what happened in Maryland. So, again, as a clinician, I was able to really speak to the care process and the coding and the billing. But I'm not the one that has the story to tell. I can tell my patient's story, but I'd rather them feel confident enough to tell their own story. And so I had a co lead when we passed our legislation during the 2024 session with lived experience. And to actually share a short story, we had a young man, 11 years old, who testified. His mother testified and his grandfather testified at our bill hearings. This young man wants to play baseball, and he does play baseball quite well, actually. And he had gotten his baseball leg donated by charity, and he was getting ready to outgrow it. And the family was trying to figure out what to do. And these legislators hear hundreds of bills every year. And when we returned the following year to try to expand our legislation, we testified. And after we testified, um, one of the legislators point blank asked us, "Hey, because of the law that passed, did that kid get his baseball leg yet?" And that was so emotional and so empowering to think that after hearing all of these bills, that more than a year later, they're remembering this young man who testified. So that is the effect that this legislation is having in these states.
Yeah. Um, well, I can say that Adaptive Training Academy, we're really proud to be partnering with you and to support your mission in any way we can. It's a very natural partnership in that your organization's finding ways for people to have the equipment they need to live healthy, active lives, playing sports or just in everyday life. Um, we're happy to be celebrating the passage of your Maryland bills. Cheryl, can you tell us about the event that's coming up soon? And if anybody is in the area, if they want to join, how they go about getting in touch to join and participate and celebrate with you?
Yeah, absolutely. So, one of the things that, again, is really important about this initiative is not only is the coalition working to support states getting their legislation passed, but it's helping to support them throughout the implementation process and making sure that once individuals get access to these activity specific devices, they have support and resources to learn how to use them. And for individuals who aren't able to get access yet, to show them that there are ways that they can still be physically active. So what So Everybody Can Move is doing is we are holding what are called mobility days. You heard Kyle reference one that took place in New Mexico a few weeks ago, and we're holding the first one in the Mid-Atlantic region this upcoming December. And what we're doing in Maryland is we're doing it as almost a three-part mobility day. We're having a CEU course that's geared towards clinicians and physical therapists, focused specifically on running prostheses on Thursday, December the 4th. On the 5th, we're partnering with ATA, and y'all are going to be hosting an amazing adaptive athletic event at a gym in the Baltimore area that's going to work with athletes and coaches specifically on strength training and everything that you specialize in. And then kind of our, I call it big capstone event, is going to take place on Saturday, December the 6th at the University of Maryland College Park that morning. And we're going to have a variety of different adaptive sports. We're going to have adaptive strength training, running and walking, soccer, and yoga. This is a free event for the limb loss and limb difference community, and we hope that everyone will be able to join us. We do have an online registration, so we'll make sure, Alex, to get you that link that you can share. And there's a flyer as well for all of the events that can be shared with all of the listeners as well. And we hope that you're able to join us. It's going to be a really wonderful event.
Yeah. Alec, what makes me excited is both So Everybody Can Move and ATA believes that movement is medicine, and we're tackling the same exact problem from different sides of the equation. While we're changing policy to make sure people can get access to prosthetic and orthotic devices needed for movement, you're truly changing what practice looks like by training coaches and gyms and rehab professionals to create those adaptive spaces where everybody can move. And so together, we are making this beautiful full ecosystem from policy to participation. And I think we're all playing this role in ensuring that we do have a future where people with disabilities can thrive. From the moment you're born with a disability or you acquire disability, your entire journey is seamless. From access to coverage to the device you need to return back to sport and physical activity to the systems and the spaces to exist so that you can thrive. And so really excited about what we're going to be able to do together, Alec.
Yeah. Well, I really appreciate both of you, what you do and your time. Like I said, we'll have both of you on individually at some point in time because I want to dive deeper into your roles. Kyle, hear about your story and how you train and being a triathlon Paralympian, and Cheryl, you too, as a certified prosthesis and orthosis. I guess doctor. Is it a doctor?
A clinician. So
Clinician.
so and we can even talk about the training on the podcast as well because it has evolved in even the last not even 15 years, which is
That's
really
great.
exciting.
Yeah,
So
but
yeah, I would love to
I'd love to
teach
hear
you more
that
about it.
to pass on the knowledge. But thank you guys so much. I
Yeah.
really appreciate it. And we'll follow up. We'll have the links to everything we mentioned in the notes. Thank you guys so much, and have a great day.
Thanks, Alec.
Thank you so
Thanks.
much.
Thanks.